Good morning. Good morning. Happy Tuesday. Welcome to all of you. This is our daily natural health news live show. And I'm your hostess, Dr. Melissa Gallagher. Welcome to all of you. We're going to talk about COVID and understanding your risk. This is a new kind of guideline developed by the folks over at Texas Medical Association. And we're going to review that today. We're going to review a whole bunch of news and also some additional studies and analysis from Spain in terms of the lack of antibody development with this virus. So we're going to talk a lot about that today. Welcome to all of you new joining. If you are new, I hope you'll hit the subscribe or follow button here on YouTube and Instagram. And for my regular followers, just comment and let me know where you're tuning in from. Also, many of you know I am working from home and I'm solo with my he's not even 5, he's 4, my 4-year-old. So he might be coming in and he usually makes 1 or 2 appearances on the show. So appreciate your patience as I'm a working mom trying to cater to all of you and educate you all to be safe and well during this global pandemic. So with that being said, let's dig into some news. The world is at 11.5 million cases. The U.S. is quickly approaching 3 million positive cases. And globally, we're seeing a significant rise and even spikes in some areas that had maintained and lowered the status of their viral outbreak. So, for instance, Brazil continues to rise. They're at 1.6 million. India is definitely an epicenter there at 723,000 cases. Russia is nearing 700,000. They're at 694,000. And then Peru is at 305. Chile is at 298,000. And a note on Brazil, Brazil's president apparently announced that he is showcasing symptoms of COVID. He recently had an MRI and supposedly the scans show his lungs are clear. But today he is undergoing a COVID test. So that'll be interesting. He is a anti-COVID, he's a COVID denier, anti-masker, and potentially has put himself in some risk categories in terms of not practicing safety measures to limit his own exposure. And another note, we have a large following in Australia. Australia, you guys have a lockdown happening in Melbourne. Yesterday, I highlighted that there was a lockdown of the border between South Wales and Victoria. Now Melbourne, the city, one of the largest cities in Australia, is in lockdown. That includes several, like 9 public housing estates, 2 suburbs, and 12 different postal codes. And the lockdown will be for 6 weeks in total, and you're only allowed to leave for groceries, caregiving, gym, or work. And they are really locking down, trying to minimize their exposure. And, you know, when it comes to just in terms of the severity, you know, here in the United States, we are in a full-on explosive surge in this first wave. So everything is relative, you know, putting up 10,000 cases in a day is now something we're becoming more familiar with. Well, Australia is dealing with 3,700 cases and they are locking down one of their largest cities. So that's just something to take note of in terms of how they're dealing with that. Here in the States, we've had potentially, it could very well be either how things are being reported or just such a backlog that we did see not as record-breaking of a day as we saw over the weekend for yesterday's numbers. But California did have pretty substantial increase. They had 11,000 positive cases. So they're now, they still are in the second most populous state in terms of positive cases at 271,000. Florida now has been categorized as the epicenter in the United States. And so Florida, they're the hot spot. There are certain segments of Florida that are showcasing hot spots, but they added 6,000 cases. And Texas is right behind them they're now at 200,000 cases, and they added 5,000 more yesterday. There's a few things I want to highlight about Texas. So one of the things is in early June, it was indicated that there were 210 positive cases in the child care centers. 141 staff and 69 kids have tested positive. Accelerate that to a month later, and we have over 1,300 positive cases in child care centers. 894 staff have tested positive for the virus. 441 kids have tested positive. I don't have the individual breakdown of asymptomatic, pre-symptomatic, or symptomatic, but this is just telling as we start to reassess reopening schools and possibly parents like myself getting back to some sense of normal work structure. And also in Texas, a mother, a pregnant mom in March, I think she was 29 weeks in March, she tested positive for COVID. They kept her in the hospital setting, and she has survived that. And yesterday, via C-section, she delivered all 3 babies. They're healthy. But that is a very good story for the pregnant moms and moms that have just had newborns. We have seen some weird kind of scenarios with pregnancy. Pregnancy somewhat is showcasing some protective aspects for the mother. And then as soon as she delivers, because of the hormones and the recalibration of her body, she ends up testing positive. So we'll be monitoring this. The 25-hour mark is where she'll have another positive test. But as of a few weeks before delivery, she had 2 negative tests. Unfortunately, because of that and the nature of Texas and what's going on in the healthcare system, she did all of this with the help of nurses, and her husband, family were not able to attend the birth. And that is one of the challenges in the state of our healthcare system. Well, we are seeing a reduction in the percentages of fatalities. And granted, we're about 2 weeks behind in terms of the positive cases matching the fatalities. So there's a 2-week lag, like everybody who's tested positive, 2 weeks later, there could be some fatalities. We need to understand that it's not just about dying, it's about quality of life. And it's also about pre-existing conditions that are accelerated, like diabetes. If you're in a pre-diabetic state, there's evidence that this does present as full-blown diabetes, type 1 or type 2. And that could be a permanent situation. We are seeing permanent lung damage. We're seeing blood clotting disorders. We're seeing the cytokine storm damage on the body that's long-term. So it's not just about fatalities. And I'm not going to say spam, but I've gotten a lot of email from critics of science and folks that are in denial and are not accepting of the data we have. And because of this being a novel virus, we're learning more and more every day. And also because we're getting to understand how do we address this virus, we have better therapeutics. So we are seeing a reduction in the fatality rate. That does not minimize the severity of this virus. And it also doesn't minimize the requirement that we all need to be taking on and sacrificing is wearing a mask. This is not about personal freedoms. It's about public safety and keeping you healthy and safe from an airborne related disease. This is aerosolized, which means you can absorb particles. You just don't have to touch them if they're on a coffee mug or on, a shared lip gloss or whatever. That this is a critical factor for our safety. So I just want to highlight that. And by the way, I do have some vendors. These cloth ones are made by my friend Sarah. So if you want to grab some, definitely buy a pair and a spare or multiple. She also has kids versions on Etsy down below. You can link there. And then these are cone shaped. For a lot of you who have mask fitting challenges and breathing problems, this is probably the better of the ones because it allows much more space here so you can actually breathe. This is accessible through a vendor down below, US-based vendor, and he has 10% off. So I just put that out there because we really need to be cognizant of the fact that as we learn more and we're better able and adept in the medical settings to care for individuals who test positive and it becomes moderate to severe, we are seeing some positives. That's the benefit of amazing healthcare providers doing their work. And some of them ad-libbing and testing things out, like putting people in prone position, helping increase their oxygen levels, minimizing the need to be on ventilation, because we do see ventilation is not the route you want to go in. So I put that out there because I have been overloaded with messages and comments that are the antithesis of scientifically founded data and information. And we have to approach this from at least from my perspective in the healthcare world, healthcare providers. It doesn't matter if you have a DO, an MD, a PT, an NP, an ND, any type of credentialing behind your name. When we study the body and we study biology and biochemistry and we study microbiology and the inner workings of the body, from our endocrine hormone system to our electrical system, it's science-based. And I just have to say this. I've had 4 years of doctoral training, education, and clinical work. That does involve science and data. And I don't know why people think that naturopaths are against science. I've gotten people saying that I'm a sheep and I'm selling out and paid by Bill Gates. It'd be great if he paid my bills, but he doesn't. So with that being said, naturopaths are very much founded on functional medicine and practices that are scientifically backed. And there are cases where sometimes there are certain herbs or homeopathics that don't necessarily have clinical data on them. And we do see expertise in that. We need, as naturopaths, to do more work in writing for journals and highlighting our clinical cases and the presentation of those. But we don't deviate from science and we don't deviate from medical expertise. And there's this expectation that we should all do that. And the fact that there are individuals that are against or don't recommend face masks, to me, that is malpractice. So I'm just putting that out there. That is where I stand. I've always stood with science and fact and information. I partner with physicians and clinicians all the time. I have friends that are ER doctors and nurses. I have family members that are in the healthcare world. Anybody who has any sense of any type of clinical medical training will tell you mask wearing, given what we know right now about this virus, is highly effective, and we have clinical data to prove it. And I post that on all my shows. So I just have to do that PSA. Please be cognizant and safe when you're out and about. We will get to the second part of our show. We're going to talk about these risk factors. This is really effective. And we can talk a little bit about how do you kind of manage living life and balancing the risk. But also I want to talk a little bit about universities. Yesterday I highlighted Georgia Tech has petitioned the state. There's no sort of response or movement there, but Harvard University, one of the more prestigious universities, Ivy League, has come out and indicated that they will be bringing on only 40% of the student body to live on campus. All classes will be online. They are not giving any type of tuition credit for going online. So, it is a very expensive school to go to. They have a massive endowment as well. That is pretty phenomenal. But that is indicative that is going to be an indicator. They're putting out a stake in the sand, so to speak. Harvard is clinically founded. They're backed in science. They're research oriented. They are not going to deny what science tells us. And what science is telling us is that being in enclosed spaces is unsafe, and building spaces. And, Boston's a beautiful town, but for many months it's freezing. It's not like they're going to have classes outside, on the quad and enjoying their beautiful campuses, because they have multiple, the business school, the medical school, they're all different types of campuses, basically in between the river or on both sides of the river. So on that note, Harvard has, made that statement and are rolling out those plans. Princeton also has indicated they will have normal class, or they will have on-campus classes. They will also have some virtual options. This is pretty phenomenal. They did implement a 10% tuition reduction because of that. There will be shorter class times. They will have the same, Harvard or Princeton's a smaller kind of group setting. So they might have 15 students in, say, a history or English lit class, or, lab or whatnot. And they're going to have them in bigger rooms. Uh-oh, what's going on? You're so thirsty. Okay. Oh, honey. Here, you want to drink mommy's tea? Here, have a little bit. It's got some honey in it. Okay, can you give me 10 minutes? Here, why don't you go get a cup from the bathroom? Go to the cup go get a little cup and go to mommy's room, okay? Okay, sorry, you guys. That's the drama of a 4-year-old. Okay, so Princeton, they're going to be having holding smaller classes in bigger spaces to allow for social distancing. And they are not going to have any breaks. So they've already determined no Thanksgiving break, no spring break. And that might be telling. We might see some more universities coming down with that. I have a feeling that we'll probably see some divides, Northeast versus South. We might also see some divides from the West and Midwest. As we see the epicenters, Florida is going to be the big question mark right now. So I also want to highlight in terms of contact tracing, one of the challenges right now is we have such an overgrowth of cases, particularly the epicenter in Florida now. Contact tracing is not possible in these southern states, which means it's now gone beyond the spread of being able to contain it in terms of being able to trace who might also be contagious. And so, some of this is asking that people self-report, which, that's only as effective as the people choose to self-report. We saw that here locally. A restaurant was encouraging the one employee who tested positive. I'm not kidding you, no joke. A Mexican restaurant. We have never gone there, but I saw it on the threads. And confirmed by the employee that the company had texted her and communicated they did not want her to make it public that she had tested positive. So, that just remains to be another dilemma, even when people are wearing masks, are they reporting their cases? So I also want to highlight that one of the things that is posing a potential risk for folks in Michigan. There's been some communication that it's summertime, people are out and about, and Michigan has over the course of the last 6 to 7 years have seen an increase in tick bites that not just cause Lyme disease, but also carry anaplasmosis, which has very characteristic symptoms of COVID. So there are some warnings in the healthcare world to Michiganders or anybody summering up there to be cautious of tick bites and to avoid ticks or tick areas, marshes, high grasses, woods, and things like that. So I do want to highlight here, let's see. Oh, here it is. Sorry, they really got me all wound up. Okay, so I have this study and I haven't linked to it, but I'll post it. This is a study, a Spanish-related antibody test. So it is entitled Prevalence of SARS-CoV-2. That's the name of the coronavirus. In Spain, a nationwide population-based sero-epidemiological study. So sero meaning antibody. So a backward assessment of anybody who's come into contact or has tested positive. What they did is they looked at Spain through April 27th through May 11th, almost 36,000 households were selected. And they did serological testing on them, antibody testing. And what they found is that only 5% of the individuals who were tested showcased detectable antibodies. This coincides with another antibody test that I highlighted about 2.5 weeks ago, showcasing that the antibodies, it was hit or miss. It wasn't even 50-50 if the right antibody was developed. And for the antibody that we needed for some immunity, that only lasted between 2 to 3 months. Usually at 12 weeks, they showed no detectable signs. So this study specifically identified who is eligible, and then went into a total of folks that ended up getting tested. Ultimately, they tried to test 102,000 individuals in total, and they do a breakdown of the type of the age group, The highest age group was 50 to 64 in this particular study. And a majority of them were active workers. And then a lot of them at that point were telecommuting. So these are folks that are in lockdown. But basically that test literally showcases that 95% of the population here that they tested does not have there's no immunity. The body would not recognize or develop any immunity if they were to get exposed again to potentially a new strain. So that's very telling for, there were a lot of folks, I haven't heard it so much, but a lot of people going, oh, we have herd immunity. We just need herd immunity. And this does not indicate that that's possible. So this is out of the journal, The Lancet. Lance has been producing a lot of the data that I've been presenting to you, and that's based in the UK. So that I think is really interesting in terms of, are we protected? And I just saw last night, I was watching while I was doing my little detox thing, one of my Bravo shows, my junk TV. I rarely get to watch it, but I was like, woo! I was doing my little sweat detox and trying to get caught up on my Real Housewives of New York. I just guilty pleasure. And I saw a commercial for encouraging individuals who have tested positive to donate plasma for potentially development of antibodies. That may or may not prove to be highly effective given this particular study, that even though there are individuals who have presented plasma or presented antibodies, that might last a long time. And it might not be part of the it might not be part of a preventative plan, but the serological studies, the antibodies, does help individuals in an active, moderate to severe case of COVID. And that's why they're asking for folks. So, it remains to be seen. Therapeutically, antibodies might just be a therapeutic resource, but it doesn't necessarily indicate herd immunity. So I do want to go over specifically the impact of our day-to-day lives on potentially our risk factors. And I really love this. This is the most thorough assessment thus far. I have had some other ones. I'm trying to see. I brought a whole bunch of stuff from downstairs the other day, but I don't see it. I had like kind of a checklist, and I had posted it, I think, on Instagram on my stories. I posted this to my YouTube community tab with a link to the download. I'll also put that link here. But this basically breaks out low risk to high risk categories. And so the lowest risk for us is opening the mail. Okay, so that's on like low risk. The highest risk is going to a bar. So going to a bar versus opening mail is hands down the lowest risk factor. So I also want to highlight some other lower risk. So the lowest risk is opening mail. The next step up in low risk is getting restaurant takeout. That's 1. 2, pumping gasoline. 3 is playing tennis. And the other one is going camping. Now, high risks on the far end, okay, it starts with eating at a buffet. First of all, buffets are horrible anyway. That's the biggest point of salmonella poisoning. Never eat them, and never eat the onions at buffets. They absorb all the junk. So eating at a buffet, working out at a gym, that's high risk. Going to an amusement park. So Universal Studios is full on advertising. I saw one of those ads too. Going to a movie theater, that's high risk. Attending a large music concert, high risk. Going to a sports stadium, high risk. Attending a religious service with 500 plus worshipers, that's considered high risk. And then going to a bar. So, the point that they're trying to make is, enclosed, like movie theater enclosed, a music concert, depending on the venue, probably most of them are enclosed. That's high risk. Sports stadium, most stadiums are enclosed. Hockey, football, basketball, that's high risk. Same with church. So that is a big difference. Now, I've also had folks highlight, well, what about the protesters, protesters, they're, wearing masks or not wearing masks or gathering. Why aren't they being categorized? Well, we're seeing that there's no contact tracing identifying the spread through the protesting. So I just want to highlight that. That's just what we know right now. That could change, but that's why it's not listed. Moderate high risk. And these are some things where I think we just kind of have to assess. Like I did the hair, I had hair salon a la Melissa here last week. I cut Gabriel's hair one day and it turned out good. I was pretty proud of my skills. And then I also cut Brian's hair the following day. He has an insane amount of hair. I have to get my hair cut at some time. It's getting really long and, but I have to weigh that risk. And many of you probably are feeling the same thing. You might need a little hair dye, or you just might need a little straightening or whatever. So going to a hair salon or a barber shop is considered moderate risk. Now, there are some categories there, and we saw this in that one case where there were two hairstylists at a salon, like a Supercuts. They were wearing masks. All of their employees their customers had to wear masks. There were social distance between all the chairs and lots of hand sanitizers. And I don't know if there was even HEPA or UV in the facility, but nobody contracted COVID. So that is an indicator specifically of how to mitigate that risk. Mask wearing, social distancing, cleaning hands, washing hands, and hand sanitizing. So that is an indicator of all those things coming together to be a very effective way of limiting the spread. But these are categories that are listed as high, moderate - high. Going to a hair salon, eating at a restaurant inside, attending a wedding or funeral. So many of you know we had to postpone our wedding ceremony. We've got it rescheduled to April. We're really freaking out because Florida is probably not going to get their act together. We might be scrapping the whole thing or doing something different or changing the dynamic of the whole event. Also, traveling by plane, playing basketball, playing football, and hugging or shaking hands when greeting a friend. Those are all considered moderate high risk. And I see Emerald Style 17. My stylist came masked to my backyard and cut all of my family's hair outside. That's awesome. I don't have that relationship yet with our hairstylist. I actually have a few that I go to. Some just blow my hair out for video. As you can tell, I don't really do a whole lot to my hair, and I have naturally curly hair. So it's just easier if I put it back and it dries somewhat straight. But in Florida, I could have called our girl to do it. So I'm glad that you have that option. Outside would be ideal. The challenge is we're in summertime and it's really hot for folks. Cupcake Pipper said, I cut my hair with manicure scissors. Yes, that's definitely an option. Okay. So, those are things like eating inside a restaurant. I don't think it's not necessary. There's no reason why you need to do that. You can get takeout if you want to have friends over, have it so really socially isolated and distanced. I mean, there are ways to mitigate the risk, and that is what I want to encourage all of you. So there's a sense of, I'm getting a sense from a lot of emails and messages, and they're much greater now. I'm getting a sense that people are nervous that life just won't ever go back to normal, and that we're reaching the 4-month mark and we're just sick and tired of this situation. And it's not improving. And there's also possible risk of your area getting into a lockdown again. If you can really assess what's the riskiest thing that you want to do today or this week, is probably a good way to go about doing this. Where, on a risk category, if I were to get my hair cut, that would be the only thing that I do that week. And I would be mitigating every other risk. And that would include all parties in our family. So for instance, moderate risk, and there's kind of two buckets. So on the higher risk, on the higher scale of moderate risk, sending kids to school day camp or daycare, that's a number 6. So out of 1 to 9, school is number 6. That's a reality that we're all going to have to get comfortable with. 6, working a week in an office building. Today is Brian's second day in the office. He got a note from his doctor who said he needs to work from home pretty much indefinitely. So, because he has a really rare autoimmunity that if he were to get even a cold or flu can drive his platelet levels down to basement level, like bottom level numbers, where then he has to get plasma transfers and, IVIG, immunoglobulin therapy. That's very risky. And so he's now going to be coming home tomorrow. Another moderate risk is swimming in a public pool. That is considered moderate risk for a multitude of reasons. I was talking with one of my friends who lives in Texas. And, for a lot of my lymphatic patients, I recommend get in the pool. Pool is the best way to move your lymphatics. It's really great for also mobility and joints and things like that. Well, a pool is risky. You've got, the chlorine in the pool will kill the virus. But you also have lanes, so people could get too close. They're breathing, so you're not masking while you're breathing. And literally, there are respiratory droplets that you're exposed to there. The getting into the pool, so you've got a locker room setting. You're probably walking into a facility or center. So there's a lot of points where it could be very risky. Outdoor, we have a pool in our neighborhood, and there are all different types of people gathering. And, the handles and then just exposure and the lack of social distancing is a factor. So that's why pools are considered moderate risk. Another thing that's considered moderate risk is visiting an elderly relative or friend in their home. So if you guys like this information, please give me a thumbs up. I'm grateful. YouTube's been really appreciating all the liking and the commenting. So I really appreciate that because it really does help accelerate our message to the broader community. And also in the moderate range in a 5. So smack dab right in the middle here. I'm going to list out what these are. Having dinner at someone else's house, that's moderate risk. Attending a backyard barbecue, that's a moderate risk. Going to the beach, that's a moderate risk. And shopping at a mall, moderate risk. I think there are points to be able to drive those risks down. If you go first, so get to the beach before everybody else gets there. So if we lived at home, which we miss the beach so much. We used to take the dogs to the dog beach. I would take them early in the morning when nobody else is there. They could run, we could swim and be gone before everybody gets there. The beach is more so about the amount of people and the quantity of people there. If you have a secluded area where there's nobody there, that's totally safe. But you have to evaluate what is your proximity to other people and then the quantity of people. So it's about mass volume, but also many people are just not going to wear masks at the beach because nobody wants a suntan line on their face. So those are things to consider. Same with shopping at a mall. I mean, nowadays, a lot of these mall vendors, they're pumping out all their online retail. I've purchased a few things on one of those, sale things, summer sales online, and it's delivered to my home. And even if I try stuff on, I can return those. So it really limits your need to be at a mall. Now, on the front of a mall, I know that a lot of my senior viewers will go to malls and walk. It's air conditioned. It's safe. You can walk, 5 laps around, how many miles you've done. You see your walking friends. If you can switch that up to a local park where you're, walking and social distancing, that is much better. So those are the moderate risks. Now, low to moderate risk, there's going to be some variances here. On the lower side of low moderate risk, grocery shopping, going for a walk, run, or bike ride with others, playing golf, and then so those are 3. So grocery shopping, run, walk with friends, and then playing golf are 3s. The next category, low risk, is staying at a hotel for 2 nights, sitting in a doctor's waiting room, going to a library or museum, which, by the way, many museums actually internationally are online. You can do virtual tours, which is really cool. We've done a few with Gabriel. For also eating in a restaurant outside. And eating outside is one of these things where I want to also present, depending on the restaurant, where it's located. I've had some viewers comment that they were seated outside. Servers are wearing masks. They're wearing masks until the food comes. But they're also right along like a main thoroughfare where there's like sidewalk or people are walking. If that occurs, those seats right near where people are walking are going to be riskier seats. So those, you pose the risk of people not being masked, they sneeze or whatnot. Similarly, like eating in a restaurant outside, walking in a busy downtown, and spending an hour at a playground. So that, for me, it was really exciting to see, spending an hour at a playground. We haven't taken Gabriel to a playground. And like, I will bring my Force in Nature sanitizer, which, by the way, there's a link down below. If you guys are interested, this is a green cleaning sanitizing unit. They have a special discount going on today for these units, but it's an electrolyzer and it turns water, salt, and vinegar into antibacterial, antiviral, EPA approved, very green. I'd fill up my whole bottle and I would spray down still the playground. I'm still not like 100% okay. But yesterday we did go out for our nap ride. Gabriel only takes naps in the car. So we went out for a ride and I found a playground that nobody seemed to be at. So it might be our go-to. It's kind of tucked away. But those are things like, think about, like, are there playgrounds where people wouldn't, where there aren't a lot of kids, whereas there's one playground right near where there's a horse farm and there are always kids there. So I would not go there, but I would go to one that's less populated. So definitely check this out. I'll include links down below. This is out of Texas Medical Association. They are on Instagram at WeAreTMA. I think this is really critical. I think this is something you could post to Facebook, you could send, you could print out, you could post, in your office, apartment buildings. I think that is a really good guide to determining what your daily activities are and how can you mitigate the risk. So let's say you have to do a high risk, which honestly, you don't have to do any of the high risk, from eating at a buffet, working out at a gym. The gym component, gyms are back open. My gym, I'm not going to be renewing anytime soon. They are not posting pictures of people wearing masks. I'm not seeing social distancing. Cleaning's great, but gyms are risky. And if they had outdoor activity, I might sign up for. But at this point, I'm going virtual with my workouts. And that is something that you may have to make some decisions that aren't really fabulous, but for the time being, mitigate your risk. And everybody has a different risk category. I saw a friend of mine as a recent aunt. So there's a newborn in the family, and the question was, how do we lower the risk? And every family has different risk mitigation. Like for us with Brian, we're gonna be on the lower side. Like, I want limited risks, and we're going to limit our risks every day. But we're being way more stringent because we have a pre-existing health condition in our family that is very risky and could be fatal. So that is different than somebody who doesn't have that. And then maybe there are families that have children that have juvenile arthritis or have diabetes or have had a heart transplant or an organ transplant. Those are going to be different categories. And what you have to do is you have to determine what risks are you comfortable with and know they are risky behaviors, and then take measures to protect yourselves and others in those settings. And that, at the end of the day, is the best that I can recommend for you. I mean, apart from saying, please wear a mask, it's not my task to tell you how to live your life. And I'm not trying to do that. My goal for all of my patients, my consumers of content, my customers and family members, everybody I love, friends, anybody we contact with, we want them to be safe and well. And there are different ways for you to do that. But just know, mask wearing, there will be, just like how the World Health Organization, it took them a while to come around to, different data. They're very slow. I'm not saying I don't trust them, but they're not the fastest to react. They're bureaucratic in their decision making. But we know certain things about this virus. It's aerosolized. It's also, the particles are on surfaces. We know that. Okay. So knowing that, you need to mitigate your risk. Do you necessarily need your state to mandate mask wearing when you know a virus is aerosolized? That's a common sense factor. And yet people are saying that is just all of the different arguments against it. This is what we know. The surfaces and the aerosolized particles are contagious. And that is how we see transmission. It's been studied. We've studied in labs. We've identified how far these particles go, even droplets, how far they linger in the air. We know outside activities, there's less of the lingering. When it's hotter and humid, the density lowers that expansion. And that is why these outdoor activities are much better to engage in. So do get out if you can. Like, it's hot and humid here, and we try and get out in the morning and later evening, but try to get out and about and get in nature, because this isn't going away anytime soon. And the fall and winter months will be here, and then we're really going to feel trapped. And so I just want to encourage all of you to get out in nature, put your feet in dirt, sand, on the grass, and try and be as outside as you can that's comfortable, while also mitigating your risk factors. So, please do, for sure, wear a mask. And eye protection. I mean, that is the other thing. Face shields protect your eyes, your nose, and your mouth. The other thing too is make sure that you sanitize your hands, you wash your hands, and you don't touch. We got to keep up with these activities of good hygiene and mitigating factors like hand sanitizer, face masks, goggles, face shields, all of those protective measures. So that's my communication to you. Alyssa says, I do think how we manage our family's health is an individual decision, and having information on risks is so important. It's very true. I mean, everybody is going to be a little different in terms of what you're comfortable with. In the world of health, maybe it's because I'm a practitioner and this is what I've studied, but I'm not going to be blasé. And that is just where my personal decision is. Also, it helps that I'm putting together these shows for all of you. And I know the research, I read it every day, and I'm consuming it way more than the average individual. So it does give me a lot of concern. It gives me a concern too, that perfectly healthy individuals, like, I think his name was Nick Cordero, the Broadway star that passed yesterday, or maybe it passed Sunday, but, he had COVID complications, perfectly healthy 41-year-old individual. And I'm in that category. I'm 41, and I have a lot of friends who are in our, late 30s and early 40s, and we think we're invincible. We're a little bit more cognizant of our health status, but it can take a 40-year-old down. It can take a 17-year-old down, an infant, and an 84-year-old. And then we also see positives. We see 102-year-old survivors and individuals who live on ventilators and recover. So it does affect people differently. And there's no way of knowing how it will affect your body until you get it. And I don't want to, I'm not in that category of taking that risk. That's just where I stand. And I am not going to judge other people who do. But I do see folks where it makes me nervous and anxious for them, but that's their body, that's their health, and that's their life. And so if people want to take that risk, okay, that's on them. But there's a point where their risk taking does infringe on other individuals when they're not taking the right safety measures. They're not wearing face masks, they're not protecting their eyes, they're not washing their hands, and they're completely evading and ignoring guidance that is meant to support public health safety. So that is my little soapbox. Let's see. Lorianne, Nick was from my town in Canada. We are heartbroken. My son also works in the film industry. The whole industry is crying. Yeah, he is I really feel for his family and his wife, Amanda. She was a shining light of like energy and positivity and just quite amazing that, she was so strong through all of it. And, the challenge with COVID is that these patients are not able to have their family with them. And so they're not able to have that physical closure of somebody taking their last breaths and holding their hand through it. And that is heartbreaking. Sand Dollar, hi, I want to order your UVC sanitizers you recommended about a week ago. Have you verified the fake UVC out of China as I want? Oh, so I think you messaged me yesterday. I responded, yes, I verified them. We're using them now like this. And he's got another one in his office. What is that for? Oh. Okay. You want to say hi to everybody? Here, come say hi to everybody.
Hi, everybody.
Isn't he the cutest? You want to tell him how many? Oh, this is really fun. How many birthdays do you have?
2.
2. Tell me, why do you have 2?
Because one was already there and one was already coming up.
So you've had one already.
Uh-huh.
When did you have your birthday? When did
The
you have
last few days.
The last few days. So every holiday Gabriel likes to celebrate, right? You want to tell him about the cake we made? No? We made a special cake. We made a coconut oil cake. Here, let me open that for you.
No, I have that.
You got it? Okay, just take one. So let's see. I totally got sidetracked and I have to put his Lego together. Here you go. Here's your Lego. All right, I'll be done in about 5-10 minutes.
I want it on here.
Okay, well, show me where you want it. Where do you want it? Hold on, you guys.
Over here where the tires are.
Okay, here, bud. Is that it? No? Okay.
I'll show
you want it? Oh, okay. But it doesn't fit. These tires are too tall. See, it doesn't fit. There's a gap. Can you find a bigger one of these? Okay. All right. Legos, bane of my existence. Those things are horrible. We've stepped on so many already and he hasn't even started. Okay. So you guys are really cute. Let's see. Okay. So that was really, I really want to encourage all of you to be healthy and safe, but at the end of the day, you're living your own lives. It's just one of these things where your potential lack of safety could infringe on somebody else. And so that's just a note for all of you who are sitting here anxious about people not wearing masks and you're out and about and you see just the degree of nonchalance people are taking about this. It's unnerving. And I totally hear you and I feel you. So I'll just keep highlighting this. And it helps too if you like this and you hit the share button. And for Instagram, you can take screen grabs and post your stories. That does help us get the word out about our mission. And even when the folks comment, we get the spammers, they comment, they actually help our algorithm. So more power to them. I just thank them for commenting and supporting my mission. But definitely, this is something I wanted to highlight. I've had a lot of questions about this specifically, and, we're just going to have to get through this together. And the challenge is we've seen so much growth that there's a possibility we might not be able to get back to some stable level, particularly seeing in Florida, without any type of major actions happening. And there will be a hit economically. There's going to be a hit socially. But it's concerning. You're going to hear a lot of healthcare professionals getting really concerned. And when ICU capacities are getting higher, we can't deny the fact that a normal case of a heart attack or a brain aneurysm or, a failure of an organ needs an ICU bed. And when COVID beds and Sarasota, they've now opened up new floors for COVID cases. It is tying up also resources for everyday illnesses and health crises that need to be addressed as well. And so that is one of the things that is very, very challenging for folks. So I just really want to encourage all of you. You guys are doing great work. And just keep doing what you're doing. Just assess your risk level. So I'll include this link where you can grab this. But this is just guidance for you to determine what's the best method and approach. And similarly with the different protective gear, some things will work and some things won't. And something is better than nothing. And, I really love these face shields. I don't know if you guys are seeing, but we're seeing more and more healthcare workers wearing these types of shields and full face enclosures because of what we knew and know now from Massachusetts and New York. There was spread to those workers. And there was actually a nurse that responded to a code blue in California, no PPE COVID case, and she's passed from COVID because of her immediate response. And, code blue is immediate cardiac arrest. It can take 10, 15 minutes to get all geared up. And she went in and risked her life and paid for it. So I just want all of you to be safe. That's all. That's where my communication lies. And for DDJ2, what type of sauna do you recommend? I'm actually going to do a sauna video. I am in love with my sauna. I'm so excited. So I love doing detoxing and have since I started my health journey. And because of they don't have spas and massage on here as a risk category, but it's in the high risk. And so, my traditional routes of going to do some of my activities, I've now brought them home. So I'm going to be doing a video on that. Can we wear a face shield versus a face mask? Yes, Christine. Hey, Christine. Yes, you can wear a face shield. It does help if you layer up, but this for sure will help, the way this works. And this has a protective, there's 2 layers of coating. I haven't taken it off, but it allows you to see better. But basically you put this on like this and it comes over here and down to here. So particles that are coming directly at you from here are minimized. There's still a potential route of your own respiratory plumes coming out from under here. But for protecting you, yes, this is totally a possibility. And these are really inexpensive. So I'll post a link. I got these on Amazon and you can buy like 10 packs of these. And then the other thing to the note of like comfort level, try out different types of masks. We all have different facial shapes. And then we also have different lengths of our nose and widths of our mouths and our lips and stuff. And so, the big thing you want to try is see what works for you. They say this is what they call a cone shape. This is really great. So for people who are talking a lot, like this is very comfortable for me to wear and to talk and not feel like I am kind of inhaling my mask. So this is from that one vendor I have that's giving 10% off. But, do experiment with. So, if one thing doesn't work, try something else and see your comfort level. But I would definitely, I would have UV plus facial shield plus mask. I think that's one of the best. What type of UV? So UVC is what I posted a video specifically about, I want to say last week, maybe last Monday. And I don't know if you guys can see, I have that black unit. I have a few others. I have this wand. Let me turn it on. I have this one. There we go. So this is like just a small UV wand that, you can sanitize. Let's say like I wanted to sanitize this. You could put this over and just have this resting on it, sanitizing it. You can sanitize tabletop surfaces, groceries. The other thing too is you think about like handles. So the grocery handles. So I'm now combining this in when we get our deliveries or our boxes. I just scan over that. And I'm now limiting how much of this I have to use. But I use both. So I use my Force of Nature to clean our surfaces. And then I follow up with a UV sanitation. And so this is one of those things you don't want to put on your skin. You don't want to have it, your eye exposed to it. So it's definitely good for surfaces like my laptop is here, and I would sanitize my laptop, my space, anything that you feel is coming in that might have some exposure. The other thing too, like with the lights, you can put in your offices and turn on and have as a way to clean your office spaces. UV, I also have the rolling UV air filtration system. So EnviroCleanse is the vendor that I've had or the producer of that. And they actually had a really good 4th of July sale. I think it was like 15% off those units. But, they sanitize the air. It's HEPA. There's another filtration layer. And then they've got these 2 double UV bulbs that are cleansing and clearing out any viral bacterial particles. I will tell you, when we run those at night downstairs where the dogs are, it smells so clean. Like, we have 3 dogs and a toddler, and our house doesn't smell like a zoo. And I really feel like it's partly because of the UV sanitation. It's also really good for getting rid of dander and dust particles. And my allergies is greatly improved with those. So I love those. But I've got links down below. On Instagram, now my show gets wrapped up and it goes on Instagram TV. I don't know why. I don't know if it's because I hit 10,000 and that's what happens. But so they're there permanently. So I have a whole COVID playlist. I think this will be number 17. And on YouTube, you guys are, I think, 110 or 112, my 112th show. So pretty crazy. And I just want to say I'm really grateful for all of you for tuning in, supporting our channel and supporting our mission, and really keeping you all healthy and safe. So I just want to encourage you to check out my website where you can get more information. And then also down below, lots of great links. And I encourage you to check out my friend who makes these. These are amazing. So, all right, friends, I will see you all tomorrow. Thanks for your patience with a few little kiddo visits. And I will see you guys tomorrow. Thanks, everybody. Bye, Instagram. See you later. Thanks, Pat and Ron. Have a great day. Be safe, everybody. Really appreciate you.